I see people as, again, both their good deeds and their bad deeds as byproducts of factors beyond their control. That's, again, not to say that I can engage in some kind of moral protest when you do wrongdoing, as long as that moral protest is aimed at future moral development, future reconciliation, and future safety. I can justify questioning your actions. Also, in terms of the person who just wants to sit back and say, well, free will skepticism true, I just won't do anything, or why shouldn't I do wrong things? Well, we don't have to give up on morality, I argue. Axiological judgments of right and wrong and good and bad behavior remain in place even if we reject basic desert moral responsibility. We still can say that what Hitler did was wrong or bad, right? And we want to be able to say that. We want to be able to acknowledge certain actions as good or harmful or bad. And those kind of axiological judgments are independent of desert. So we could say that what you did is wrong. And people generally should try to avoid wrongdoing, right? I could engage in some kind of act of moral protest when you do some action that wrongs me in some way. I could ask you why you made that choice. Reflect upon your own character and what might have caused you to do it. See whether that characteristic is something that we would be better off revising or doing without. And then moving forward, work to change ourselves. That is all consistent with the rejection of free will. Also, we have a right to protect ourselves against wrongdoing. So if you were to kill someone or engage in some violent criminal act, my argument is that we could still incapacitate you, even if you're not deserving of blame or morally responsible in the basic desert sense. So the argument I give here is what I call the public health quarantine model. And it's based on an analogy with people who have communicable diseases. And when I first developed this, by the way, no one had any experience with pandemics or with quarantine. And now, sadly, the whole world has personal acquaintance with these things. And so maybe in certain ways, it's a little bit easier to understand now. But the idea would be something like this. Let's say I came to meet you in person and I took, a flight abroad. And I was tested at the airport and I test positive for Ebola. Well, I think we'd all agree that the state is morally justified in quarantining me. And the justification for limiting my liberty, restricting my freedom, would be the right of self-defense and prevention of harm to others. That is, the state is justified in quarantining me so as to prevent a pandemic, to prevent large quantities of people from being harmed. Now, that justification in no way appeals to free will, or just deserts, or retribution, or moral responsibility. In fact, we often assume the individual is not responsible for having contracted the communicable disease. And yet I'm still justified in restricting their liberty. And so what I would argue is that we could give an analogous account for incapacitating seriously violent offenders. That is, we can incapacitate, not punish, but incapacitate, restrict their liberty, child molesters and serial killers and repeat violent offenders on the grounds of self-defense and prevention of harm to others, analogous to the justification we have for quarantining people with communicable diseases. And we could do so without, again, resorting to free will or moral responsibility or just deserts or retribution. Of course, if we adopt this framework, it requires extensive revision and extensive reform of our criminal justice system. So, for example, you're justified in restricting my liberty, but you're not justified in dehumanizing me or disenfranchising me. So let's say I have Ebola and you quarantine me. Well, yes, you're justified in that restriction, but you're not justified in stripping me of my voting rights. You're not justified in stripping me of all my other human rights. In fact, I retain all my other human dignity and should retain all of my other basic rights as a citizen. And so my argument is that most of the kinds of excessive forms of punishment we engage in, especially in the United States, would be unjustified. We're justified in restricting liberty, but we're not justified in other punitive measures that impugn the dignity of individuals. Second, you have a moral duty, if you quarantine me at the airport, to treat me for my Ebola and then release me the minute I'm no longer a threat. to public health. Well, I would argue the same is true with criminal justice, that the purpose of the criminal justice system should be rehabilitation and reintegration. And we lack any continued justification for incapacitating wrongdoers the minute they're no longer a threat to society. Also, I argue we have to accept the principle of least restriction. We should adopt the least restrictive measure necessary, consistent with protecting public health and public safety. So if there's a less restrictive measure than quarantine, we should adopt that. So we don't quarantine people for the common cold, even though if I sneeze on you and you get sick, I've caused you some harm. We think the common cold is an acceptable type of risk in society, that we only restrict liberty in very precise, very restricted, very unique cases. In fact, quarantine is a very restrictive measure that is only used as a last resort. We want to adopt all other measures possible before we turn to quarantine. And so I would argue that many of the current things we currently incarcerate people for in the United States would be better dealt with less restrictive measures. So going back to our beginning of our discussion, I think, for example, the vast majority of people in prison in the United States are there because of underlying drug addiction issues. Either they're there because of possession or crimes caused by addiction. The vast majority of them are not a serious threat to society and would be better dealt with by drug treatment. My model is also consistent with the decriminalization of many things we currently incarcerate people for. So for personal possession of marijuana and certain types of recreational drugs, I favor decriminalizing possession for those, because a large majority of our mass incarceration crisis is caused largely due to addiction issues that would be better dealt with by alternative means. Vast majority of people in the United States, over 50% who are imprisoned in the United States, have a diagnosable mental illness. The vast majority of them would be better dealt with in mental health services than imprisonment. And so I want to look at why we incarcerate people, the length for which we incarcerate, the purposes for which we incarcerate, and my model would drastically entail a whole lot of reform. So that was a long answer, but I would say that twofold here, just to sum it up. I mean, one, I think that if you were to just sit back and say, well, it doesn't matter what I do, that's not the appropriate attitude in face of determinism. You still have to make choices, even if the choices you make are the byproduct of factors beyond your control. And you're still going to be judged by your actions. You're still going to, I could still say that what you did was wrong or bad. And you might still be, I still might be justified in incapacitating you if the risk that you pose to society is severe enough. So I think that, we have to have ways of dealing with wrongdoing, but we also have to realize that people are embedded in social systems. They're embedded in the context of society that affect outcomes. Especially when you look at criminal behavior, people are byproducts of the social determinants that cause their behavior. Things like poverty and low socioeconomic status and mental health and environmental health and access to education and healthcare all affect criminality and criminal incarceration rates. If we want to reduce crime, we should shift the focus away from this myopic obsession with punishment to prevention and social justice, addressing the underlying causes.